Hello, everyone. Today, I have Dr. Michael Zarrabi, who is a plastic surgeon in Beverly Hills. How are you doing, Dr. Zarrabi?
Good, good. I'm great. It's nice to see you, Elon. Happy
Nice
to
to
be
see
here.
you too. Shall we get started?
Yeah, absolutely.
All right. First question I always like to ask is what really inspired you to get into medicine?
Um, that's a really good question. It was a number of things that led me to down the path of medicine. Number one, I always loved science. Science was the thing that always interested me the most in school, whether it was in high school or in undergrad. History, English, those types of subjects never really interested in me. Um, and so to me, I felt like studying how the human body works, understanding anatomy, physiology, were the subjects that I really enjoyed in the science world. And then what better than to apply that towards taking care of other people? So it was just that combination of I'm a people person. I like taking care of my patients. I like taking care of others. And I loved science. And it just seemed like the perfect combination to, become a physician.
Yeah. And what about plastic surgery specifically? Why did you pursue that?
Um, so sorry about that.
Okay.
I actually got introduced to plastic surgery at a relatively young age. When I was in high school and also during my college years, one of my very good friends, his father was a well-respected plastic surgeon in Santa Monica. So because I was pre-med, I wanted to get experience. So I went and I watched him doing surgery. And that was the first time that I kind of was like, wow, surgery and especially plastic surgery. Um, the I think the thing that always attracted me the most to plastic surgery was uh, the type of patients that we're treating, and it's not just cosmetic, but the patients who need reconstructive surgery. Because really, plastic surgery, as patients know it or people know it, is they think, oh, plastic surgery is cosmetic, and yes, my practice is predominantly cosmetic, but there's a whole reconstructive side to plastic surgery. And that philosophy of restoring someone. We're not just going in there and taking out a tumor, but we're now trying to restore their form or function, is something that really spoke to me. And I remember, because I didn't go directly into plastic surgery, I did my training in general surgery and then kind of decided to head towards plastics. And I just remember doing these great operations as a general surgeon. And at the end of the surgery, we would close the abdomen, and I would think to myself, I just did all this amazing work. Nobody gets to appreciate all that I did. So something about, being able to apply my artistic sense with surgery, being able to really show patients, well, what did we really do? Kind of drew me to plastic surgery.
Yeah, I wanted to talk about like the reconstructive versus the aesthetic practice. What kind of conditions and patients do you see in an aesthetic practice versus like a reconstructive practice?
Got it. Yeah. So my practice right now is essentially 100% cosmetic, but it wasn't always cosmetic surgery. So in addition to my plastic surgery training, I also did training in hand and microsurgery. So when I first got out, I was doing some recon, some hand, and some cosmetic, and then gradually, for different reasons, my practice has now become cosmetic. But as a reconstructive plastic surgeon, really any part of the body that you can imagine, we deal with. Scalp reconstruction, reconstructing ears, noses, lips, breast reconstruction, lower extremity reconstruction. That's the part of the beauty of plastic surgery is that you don't have to be pigeonholed into one particular thing. You know how to operate literally on every part of the body, and just about any part of the body you can imagine. During my training and during my practice, I've done some type of surgery. So I think the most common reconstructive procedure for plastic surgeons is probably breast reconstruction, with the unfortunately a lot of breast cancer, so there's a lot of breast cancer surgery and thus a lot of breast cancer reconstruction. So I hope that answers the question.
Yeah, it does. And you also mentioned that you did general surgery before doing your plastics fellowship. What do you think of these new kind of integrated programs where you just go right from medical school into plastic surgery?
I think they're great, actually. I think it's actually in many ways a better model than what I did. So there's integrated and non-integrated plastic surgery programs. So my model was I did 5 years of general surgery, and then after that, I ended up doing a fellowship, which was 2 years of plastic surgery. And really, plastic the field of plastic surgery is so broad, because you can literally operate from head to toe, that you could make the argument that just doing 2 years of a plastic surgery fellowship may not necessarily give you as much experience as someone who is in an integrated track. So the integrated track is you finish medical school and you go directly into a plastic surgery residency. And that program is usually about 6 years. Now, you're not doing 6 years of just plastic surgery. You're doing, your intern year, you're rotating on every different service in the hospital, but you do some plastics. Your second year, you're doing a lot of general surgery and you do some plastics. And then as you get into your fourth, fifth, and sixth year, you're really just focused on plastic surgery. So I actually think, I think it's a superior model to the program that I went through.
Yeah. Did you feel prepared to practice plastic surgery after doing only like 2 years of fellowship and all of your general surgery training?
Yes, but probably not in all aspects of cosmetic surgery. So, when you train as a plastic surgeon, you're not doing, you're not doing just cosmetic surgery. You're doing a lot of reconstruction and some cosmetic. So, and different programs have different strengths and weaknesses. So my program actually had a lot of cosmetic surgery in it, surprisingly. But for example, we didn't do a lot of rhinoplasty surgery. So when I got out, I didn't have a lot of experience, and I did those surgeries along with experienced colleagues who were there to kind of just be on the safe side, and I never really kind of got into it, and that's kind of phased out. So there's certain things that I didn't have a lot of experience in, and so those are not a part of my practice at this point.
Okay. So you kind of just worked around the stuff that you weren't fully confident in.
Yeah, basically. I mean, really, like we just did so few rhinoplasties that it just wasn't an area that I felt comfortable doing. And to this day, I don't do any rhinoplasties. I refer them out to my colleagues. And that's kind of always been my attitude is I know what I'm good at and I know what I'm not good at. And at this point, I will only do surgeries on patients where I feel confident that I'm really the best at providing that surgery or that treatment for them.
Yeah. That's not a sentiment I've heard like super often in like, especially in the cosmetic space where you see like these med spas of general surgeons and emergency medicine doctors just like doing all sorts of cosmetic procedures that they're not fully like trained in. What's your opinion on that?
Yeah, so I'm not a big fan of non-plastic surgeons doing plastic surgery. I think if you cannot treat so every surgery has potential complications. If you can't manage the complications of that procedure, you shouldn't be doing the surgery to begin with. And unfortunately, living in Southern California, and especially living in Beverly Hills, we get the best and the worst, And so I remember there was a plastic surgeon here it wasn't a plastic surgeon, it was a surgeon who was actually an interventional radiologist, and he was doing liposuction, and after he had enough complications, then, he got his license taken away. But that only happened after, really harming unsuspecting patients. So, I think it depends. If you're going to go into a med spa and you have a general surgeon maybe doing injectables, there's very little harm or complication associated with that. But if you're going to go to a general surgeon to do your facelift, or a gynecologist to do your breast augmentation who's never really had any formal training, I think you're really asking for trouble. So it really depends. Like if a patient is going to a med spa to get their Botox and fillers, I don't think there's anything wrong with that. As long as the person has adequate training, why not? We're not talking about complicated procedures, but I don't know that I would walk into a med spa and have, liposuction done under a local anesthetic, which, believe it or not, takes place sometimes.
That's wild.
Yes, it is. It is wild that can happen, and it does.
Yeah. What is the craziest, most interesting case that you've ever done?
The craziest, most interesting case I've ever done. Um, so there's a few that come to mind. Probably one of the most challenging cases I ever did was a patient who we actually had on the. I did an episode of the show, The Doctors. There was a guy who really turned his life around. He had lost well over 300 pounds, and myself and another colleague did a rather lengthy operation where we removed skin from his arms, we removed skin from his chest, we removed skin from his abdomen and his flanks. I mean, it was basically like a, from head to toe, complete makeover. That was probably one of the most challenging cases I ever did. But I have to say, the surgery that I probably I'm proud of the most was a patient who walked into my office. This was early on in my practice. It was a gentleman who had come from New Orleans to Southern California, and he had gone to the emergency room because he had a wound on his leg, right over the shin. And if you know a little bit about anatomy, there's skin and then there's the bone. And he had had an ulcer, a wound on his leg. And when he came into my office, he was referred to me by the emergency room. And I took the dressing off, and sitting under the dressing was his tibia. The bone was sitting right there. So, I got a little bit of the history, and he told me that he'd seen a number of doctors in New Orleans, and everybody had told him, you need to amputate your leg. There's nothing we can do. He had seen several surgeons who had said, you just need to cut this leg off. So, he said, my sister is a nurse here in Southern California, and she told me there's good doctors here in LA. Come to LA. And, I don't know. I think maybe through some higher power, he went to the emergency room. They gave him my number. So when I saw him, I, sent him to a vascular surgeon. I sent him to an orthopedic surgeon. We were able, through the help of the orthopedist and the vascular surgeon, get more blood supply to his leg. And I was able to, with the help of the orthopedist, remove kind of all the dead, infected bone. And then I did a reconstructive procedure where I moved muscle from the back of his leg to the front of his leg and basically covered the wound up. And he literally walked out of the hospital. And so taking someone who basically came to me who said, everyone else wanted to cut my leg off. Nobody wants to save my leg. And to be able to really, do a procedure that saved his limb was probably one of the most rewarding experiences of my life.
Wow. That's incredible, man.
Yeah, it was pretty wild to see this guy walk in, and he's got a wound about this big on his shin, and there's the bone. I was like, oh my God, how are you walking on this? So, yeah, but I don't really do that stuff anymore. I do mostly cosmetic. I love that. I find it very rewarding too. But that was one surgery that was exceptionally unique.
Yeah. And that's exactly how you said, is like you're restoring a person again. They, like with the orthopedist and the vascular surgeon, they probably did some amazing work. They saved the leg, but you restored him to his old self. Like you probably didn't have very nasty scars or anything. So he's whole again. That's incredible. That's
Right.
incredible.
Yeah, it was very rewarding, very, very rewarding.
Yeah. Pivoting over to kind of the cosmetic side, what are some of the things that you do in your practice most commonly?
I'm mostly known for breast and body work. I do a lot of abdominoplasties. I do a lot of breast surgery, whether it's breast augmentation, breast reductions, breast lifts. I do a fair number of patients who have major weight loss as well. So I do a lot of the patients who lost 100 pounds and they have all this excess skin. So I'm removing skin from literally their backs, their arms, their legs. And I do some facial aesthetic surgery as I've gotten older and my patient population has kind of gotten older. Those patients that I did a tummy tuck on are now coming in 15 years later saying, hey, it's time for me to do my facelift. But so I do a little bit of everything. Some things I don't do, like rhinoplasty. But what I'm really probably known for the most is as a breast and body surgeon.
Yeah, and most commonly that's breast augmentation and liposuction and abdominoplasty, things like that, right?
Things like that, exactly. Yeah.
So how do you manage expectations for the outcome of a procedure? Because as you said, like this is something that people can really see, and it's not like any other field of surgery. So how do you talk with patients about that?
Yeah. So, one of the things that I tell patients is it's really important for me to understand your goals and basically what your expectations are. So, during the evaluation and the consultation, I try to manipulate tissue to try to kind of show them, okay, if I remove the skin, it's going to look like this, or if I lift the breast, it's going to look more like that. And then we also look at photographs. So I ask patients often to bring me 3 pictures of what they love and 3 pictures of what they don't like. And so we kind of look at those photographs so that I really understand their aesthetics. And most patients come in with an idea of what they want their body to look like. But I think if you sit down long enough and talk to them about, well, here's where you're starting and here's your anatomy. And based on where you're starting and what your anatomy is, here's what you can expect. And these photos are really nice, but you don't have their anatomy. So to expect to look like this patient is unrealistic. Patients then kind of go, okay, I will change my expectations. I understand what's achievable, what's not achievable. I think the way that doctors kind of get into trouble is not really getting into their patients' heads, not really understanding what they want. I kind of know what I can achieve. But unless I convey that to the patient and the patient says, yes, that's in line with what I want, you're going to have a lot of unhappy patients. So I think it's really spending the time with the patient, explaining to them why things are going to look the way they're going to look and why things sometimes will not look the way that they want. And it's not because of the inability to do something, but just their anatomy won't allow it.
Yeah, and you mentioned photographs as being important. I was listening to something online, and this plastic surgeon said that before social media, people would come in with a picture of like a celebrity. They're like, I want to look like this. Now they're coming in with pictures of themselves with a filter. And they're like, now I want to look like this. Is that kind of a trend that you've seen? And how does that, like having a celebrity versus having yourself in a filter, how does that alter the way that you would approach somebody's cosmetic case, I guess?
Well, I mean, I think these filters, these Snapchat filters and these different types of filters have given a lot of patients a false sense of what is real and what is natural. I can't tell you how often you see something on social media and it's completely doctored. And I'm not saying that the pictures are Photoshop, but you can take someone and they may have a little extra skin or not the best shape, but if you position them just in the right way, all of a sudden everything looks good, and then they stand back in their normal posture, they look like the rest of us. So I think social media has kind of created unrealistic expectations with what we think is like the standard of beauty, you know. So when patients bring in photographs and they say, I kind of want to look like this, if it's realistic, I'm happy to say, yeah, I think that's something that we can achieve. But if it's really unrealistic, then that's where you have to kind of explain to them that, you know, this is not something that you're going to be able to achieve unless you're perfectly positioned and postured in just the right way so that you don't see that little bit of excess skin or that little bit of cellulite.
Yeah. And I'm sure, as you've seen in your practice, there's like an increasing number of people who just are so uncomfortable with themselves because of what they've seen in social media. How do you have that conversation with someone of like the potential of body dysmorphia or something that is so unrealistic in their mind that they just cannot achieve no matter what?
I'm sorry, ask me the question again. I kind of lost you. Sorry.
Yeah. How do you have the conversation of like body dysmorphia? And I'm sure you've seen a lot of it in your practice. Someone who comes in with just wild expectations of things that they cannot achieve no matter what angle or lighting that they're put in.
Yeah, I mean, sometimes you have to have those difficult conversations. Usually patients who have body dysmorphia will come in and they'll have a very, very small problem, and it will be as though it is the biggest problem to them. You know, so that's kind of a red flag when you're looking at something and you go, you know, that doesn't look all that bad, what they're describing. And yet to them, they're describing themselves as though they're completely disfigured or so I think it's with patients who truly have body dysmorphia, it's very difficult to have that conversation with them because deep down inside, they truly believe what they are saying. I haven't had too many patients with body dysmorphia, but the ones that clearly have body dysmorphia who I've tried to say, look, I don't think I can achieve your goals, oftentimes they get rather upset. They can be rather unhappy when you tell them, you know, this is not achievable or you shouldn't even do this in the first place because there's nothing wrong with you to begin with. But I think there's also patients who kind of, again, they come in with unrealistic expectations or they have photos of something that they want. And again, it's just a matter of really taking the time and educating patients and helping them understand why certain things are unrealistic and why certain things are achievable.
Yeah. And that's super important when, like, as I said, you can see you can see the results, not like how you feel or like, or I guess how much weight you've lost or whatever. It's how you view yourself in the mirror every single day. So
Right.
it just becomes I guess, a battle. Yeah, I don't know what else to call that. So with the rise of GLP-1 agonists, things like Ozempic and like Wegovy and stuff, how has that impacted your practice as a cosmetic physician?
Um, I mean, it's been good for our practice, I would say. We now have a greater pool of patients who are now who have lost weight, they're healthier, and understandably have concerns about excess skin or the shapes of their bodies. Um, so yes, from a cosmetic standpoint, from the standpoint of my practice, I think we've definitely seen a greater number of patients who've had major weight loss. I think from an overall health and safety standpoint, I think it's great that patients now can use a medication and really achieve substantial weight loss, as opposed to a patient who struggled with their weight, diet and exercise, could never keep the weight off. The solution often was, you need to have an operation, whether it's a lap band or a gastric sleeve or a gastric bypass to help you really lose weight. It's wonderful that we now have treatments that patients can use really first and foremost become healthier, you know. And then the side effect of that is that now we have this new population of patients who've lost weight who are now candidates for surgery.
Yeah. How does like loose skin surgery really work? Because in my mind, it's always just like you're like pulling on the loose skin and then you try and sew it up so that it looks nice and taut. But I feel like that's totally wrong.
No, that's actually not. That's actually not that far off. So, you know, a lot of it is. I'm not saying that the surgeries are not complicated, but essentially that is what we're doing. So if I'm doing an arm lift, a patient who has, you know, lots of excess hanging skin on their arm, we are literally removing the excess skin and bringing the two new edges of skin together. I mean, there's obviously there's so much nuance in how you perform that procedure. Because if you remove too much skin in the beginning, it looks better because it's nice and tight. But eventually, what happens is the skin responds to that tightness, and what it does is it stretches and it relaxes. So, and then sometimes when a wound is closed super tight, you think, oh, great, look at how tight the skin is. But now, because there's so much tension, scars can actually look worse, you know. But it's not too far from what you have actually kind of described. I mean, you know, we're basically just cutting out the extra skin and, you know, sewing the edges essentially back together again.
Yeah. And with that, with skin surgery specifically, how do you hide like scars? Because I'm sure if someone's lost like 200, 300 pounds, they got loose skin all over their body. So in theory, they'll have scars all over their body if you do surgery on like their extremities and their torso and stuff.
Right.
How does that work?
So some areas of the body are easier to conceal scars, other areas are not. So for example, when we do a tummy tuck, which is one of my most common procedures, we plan the incision so that the incision is hidden well in, say, a bathing suit, you know, a two-piece bathing suit. So I even go as far as telling patients in the morning, I say, bring your bathing suit in, wear your bathing suit. I will mark your bathing suit where you like to wear it on your body, and then I will plan my incisions accordingly so that your incisions are well hidden. Scars on the breast, you know, are relatively easy to hide as long as you're wearing a bathing suit. But I think the one that's probably the hardest is the ones on the arm, because oftentimes those incisions run along the entire length of the arm, and that's very hard to hide unless you're wearing a short sleeve shirt, you know. So that's the one that's the most challenging, is hiding the scars on the arms. Even scars on the inner thigh, you can still hide them kind of in the groin area, so that even if you're wearing a bikini, those scars are well concealed. So we basically, you know, we use the bathing suit as an area to hide those scars generally.
That's really smart. I would have never thought of that in my entire life.
Well, you know, and then I mean, like for example, when we do a facelift, we put scars on the face, but the scars are naturally concealed in areas of the natural lines on our faces. So you know, where the ear meets the face, there's a lot of curves and architecture. So we plan our incisions so that it's well concealed within those lines. You know, if we're doing surgery on the neck, we make the incision under the chin. So the only way you're going to really see it if someone's looking from underneath, looking up, you know. So, but none of those are things that I invented. It was the great surgeons who came long before me who invented all of these techniques. So we stand on their shoulders, basically.
Yeah, as we all do.
Yeah.
What's unique about having an like aesthetics based practice versus like like I guess a normal primary care orthopedic practice?
Um, I would probably say, I think the patients, I mean, part of the reason that I love plastic surgery is I love the patient population. Um, So, obviously you're doing primary care, you're dealing with chronic health issues. And although I see my patients a lot, plastic surgery is not one of those things where, you come in for a checkup every 6 months. You come in with a problem, you have the problem addressed, you have follow-up for, several months to maybe up to a year, and then basically, usually they're done. So, in most cases, the patients are not following up for years and years and years with chronic health issues. And I think it's also, especially in cosmetic, it's the nature of the problems that patients kind of have. Um, I just particularly like those types of problems. Some of my friends say, how do you deal with these cosmetic surgery patients? They're so demanding, they're so challenging, they're so hard to please. And I kind of go, yeah, those are the patients I like. Patients who are challenging. I like patients who are demanding. I like patients who have very high expectations um, for procedures. And knowing how to deal with them, you have to have the right personality. Like, I don't know that I could be, a radiologist, for example. A radiologist tends to sit more by themselves. They're a little bit more isolated. They're sitting in front of a computer. They're not dealing with others. That's not for me. I love my patients. I really love getting to know them. And I think that's kind of the sign of like a good plastic surgeon is they're a people person. They're more social. They really love getting to know their patients. So that, that's basically what I'd have to say about that.
Yeah, surgery is pretty notorious for being like a specialty that doesn't have a lot of longitudinality. Would you say that plastics kind of breaks with that mold?
Um, to a certain extent, but it is very much like other surgical fields. Once the patient has healed and recovered and you followed them out long enough, there comes a time where you basically say, well, I don't really need to see you anymore. Um, but if you have a practice that also incorporates non-surgical treatments, things like Botox and fillers. So a lot of times my patients will continue to come to the practice even though they're recovered from their surgery, excuse me, and because they're coming in for maintenance Botox or they're doing their filler or they decide to do some type of laser resurfacing. So it does, depending on your practice, it does kind of give you that real long-term follow-up where you're seeing your patients for years and years, or it could be, I did your breast aug, you're a year out, you don't ever have to come and see me anymore.
Yeah, I mean, kind of confirmed what I was thinking, but um, is plastic surgery clinic a lot of those repeat Botox procedures and follow-ups and things like that, or are there a lot of new patients that you see?
Yeah, I mean it's a balance. So in my practice, I actually don't do a lot of the non-surgical stuff. I have a nurse practitioner who does my injectables, so she's doing the Botox and the filler and the laser treatments. So my clinic is mostly consultations and then follow-ups. Um, so as my practice has gotten busier, I have like a medical assistant and a nurse who kind of follow me around so that I can be more efficient. So there's a lot of like teaching that goes on after surgery. Here's what you need to do with your pain medication. Here's what we want you to do with your wound. Here's what we want you to do with your scar. Here's the instructions for how to take a shower. Things like that, the staff is really good at educating and teaching. My job is to come in and make sure everything looks good, everything is healing well, the patient is doing well, there's no signs or symptoms of a complication. And then a lot of that teaching is done by the staff. So most clinic days is about 50% I'm seeing new patients, and then 50% of the time I'm doing my follow-ups. And some of them are immediate post-op, some of them are more long-term follow-up.
Yeah, and what are you looking for after surgery let me rephrase that. What are you looking for in a follow-up that will make the surgery successful? Like, what are some complications that you are on the lookout for?
So it really depends at what stage of the recovery process they're in. So I see my patient the next day after surgery. That's when I'm looking for signs of bleeding. That's where I'm making sure that the patient hasn't had, God forbid, a complication related to, say, a blood clot that's shot to their lungs, which is extremely, extremely rare, but you need to know how to ask the right questions and to assess the patients. So usually on day one, you're looking for things like, are you eating well? Are you drinking? Are you well hydrated? Is your pain well controlled? Is there signs of bleeding? And then when I see the patient, say, a week later, that's when I'm looking for more signs of infection, looking at the incisions. Is there signs of redness? Is there increasing pain or inflammation? Is there increasing swelling beyond what we would normally expect at that phase? And then once we start kind of getting a little bit later on, it's more looking at really kind of the shape and form, because when patients come back the next day, that's not how they look in 6 months. There's a lot of swelling, and there can be bruising. And so once we start to kind of get later and later on is where I'm kind of looking and seeing, okay, have the implants settled evenly? Is the swelling going down evenly? Is the contour that I was trying to achieve through that liposuction, are we achieving that shape? But most of the time, the truth is, I tell my patients, I go, most of the time after the surgery, 99% of the time, other than kind of just waiting and watching, I'm not doing a whole lot. It's just really kind of making sure that the patient is progressing along in the normal course of their recovery. So it's my job to make sure that they're following the path. And if I start to notice, hey, they're not really going down the right path, something's going on, then being like, okay, is it because of bleeding? Is it because of infection? Is there something going on that's affecting their recovery? And thank God that's obviously very rare, but my job is more just, a lot of hand holding, being their cheerleader, letting them know that it takes time for things to kind of heal and settle, but still also listening to them and reassuring them and making sure that their concerns are being addressed.
Yeah, just like any other physician, you know.
I would say so, yes.
I think we put like plastic surgeons in a weird kind of box of like they have an MD, but they don't really do like the traditional kind of healthcare. But in a lot of ways, they do. Um,
Yeah, it's just different problems,
yeah. So you mentioned earlier about having artistic skills. Do you think that someone who is not the most artistically inclined can still be a successful plastic surgeon and then further on like cosmetic surgeon?
Um, yes, I think so, because before I went into plastic surgery, I would not have considered myself artistic in kind of the more traditional sense of the word. I was never a sculptor. I was not a painter. I didn't. My parents didn't. Um, uh, they didn't put a lot of emphasis on that when I was growing up. It was always like, science, math, studies. The arts were not something that my parents kind of said, this is important too. As opposed to my kids, I want them to be well rounded, so I go, yes, you should be in art class. And so I didn't have that. But I think deep down inside, at the end of the day, if your goal is especially to be a cosmetic surgery, you do have to have a sense of what is beautiful, and understanding kind of the standards of beauty, and it's not one size fits all. So when I look at a patient, what I always try to convey to them is, here's my artistic sense. Here's what I would like to do with your body or your breast. I'd like to do liposuction here to kind of shape and contour your body here. I'd like to remove skin from your lower abdomen to help you achieve this. And so, and sometimes patients go, yeah, that's perfect. And sometimes patients go, you know what, actually, I don't like that. I prefer it like this. And if it's something that I can achieve, then obviously we do that. So you have to kind of have a sense of what is beautiful so that you can convey that to the patient. so that they appreciate my artistic sense, and they go, yes, that gels with what I want to achieve. You know what I want. Your aesthetic sense is consistent with my aesthetic sense. I'm going to let you do my surgery. Because, and I tell this to patients, I go, because it's a big deal. I always think, I'm always very flattered and honored when a patient says, you're going to be my my doctor, because at the end of the day, what this patient is saying, I will put my life in your hands. I'm going to go to sleep, and I trust that when I wake up, you will have achieved the things that I want. You know, that's a lot of trust. And so I think part of that comes by helping the patient understand the aesthetics that I think will make enhance their beauty, but still within the realm of reasonable expectations. And I think that's kind of what patients are looking for. It's not that they think, you know, let me see your artwork on the wall. And there are plastic surgeons who are, I know some who are beautiful painters. They do amazing work. I don't do any of that stuff, but they're kind of my canvas. They are my art piece that I work on, so to speak.
Yeah, that's really well said. You have to have a sense of what is beautiful, because everyone has an innate sense of what is beautiful. So, like, basically, you just said everyone can be a plastic surgeon. At least the way I interpreted it.
Right. And I'll tell you something very interesting, because um, uh, especially with social media, um, patients see a lot more about your personality. I have patients who come in and they'll be like, Dr. Zarrabi, I have been following you for years. I feel like I already know you. You know, I love the way you talk. I love the way you explain things. I love your personality. And I'm like, wow, really? I guess all of that really does come across in social media. But I think they also see my results, and there's something that unifies all of my patients. So if you look at all of my tummy tuck results, there's something that kind of seems consistent in its stuff, right? And I think patients see that and they go, that's what I want to look like too. I'm going to go to him. But I have other colleagues who have a very different sense of what's beautiful. In my opinion, sometimes it's a little bit exaggerated, you know? So if we look at how should a woman's shape be? You know, should it be more subtle curves or should it be more dramatic curves? Some of my friends do this. That's not my artistic sense. I don't like to do things that are more exaggerated. But sometimes there are patients who see my work and they go, it's not exaggerated enough. It's not what I'm looking for. So they go to somebody else. So in a way, patients are kind of looking at your work as your art, you know? So if you're going to go and buy a piece of art for your home, do you want more contemporary art? Do you like Renaissance art? Do you like more modern art? You know, so I think they kind of also see the results that the surgeon is achieving and they go, that's what I want to look like. I like Dr. So-and-so's results because that's the look that I want. Or I like Dr. Zarrabi's results because they're a little bit more, they're more natural, you know, so to speak.
Yeah. And that's just like how every artist who is wanting to go to art school has a portfolio they need to submit. Like,
basically. Yes. I guess that's our websites and our social media accounts are our, I mean, that's really what it is. It's our portfolio of our work.
yeah. And that's a huge thing, especially nowadays with plastic surgery and social media, is people are basically like, they take years to pick out a surgeon, or if they're like very young. I know, especially in like the Middle Eastern community and the Persian community, you have people who are just like, when I'm 18, I'm going to go to this plastic surgeon because I want him to do my rhinoplasty.
Right.
And yeah, you just like, they have them set for like years because they've done their like intensive research.
Yes, especially with noses. I would say yes, in particular with rhinoplasty surgery, that is very, very true. Very true.
Yeah. Have you seen a lot of procedures go like in and out of style, I guess is the right way to put it?
Yeah, absolutely. So there have definitely been trends in plastic surgery. I've been doing this for almost 19 years now. Some of the trends are more gradual. Some of them are truly just trends. So um, I'll give you an example of both. Um, the more gradual trends are that, you know, in the late 90s, early 2000s, the trend was bigger is better. So breast implants were a lot larger,
Mm.
right? And so now the trend has actually become where bigger isn't necessarily better. Women want to have implants that are relatively smaller than before. They're looking for a more natural result. Or many patients are actually coming in and saying, I'm done with these implants. I don't want them anymore. It was a mistake. They were just too big for me, or they are too big for me now. So there's definitely a trend in breast surgery of going from larger implants to using smaller implants, or even having patients who decide, I don't want implants whatsoever. But that's something that's been very gradual over time. Another one that's been more gradual over time has been the rise in we call them Brazilian butt lifts or BBLs, which is essentially taking fat from the body and injecting into the buttock. And so that's something that gradually started, and patients are paying more attention to their gluteal region. And that even within that, it started out with, well, nice shape, more volume, and then it became more and more and more volume, almost an exaggerated shape. And now patients are kind of like, no, I don't want to have just a big butt. Like, I want something that looks balanced and proportioned. So, but those are trends that have evolved over, I would say, a decade. And then there's things like, and they come and go. Like I remember in the early 2000s, when I started my practice, removing fat from the cheeks was very popular. And then it went away. And then it kind of made a comeback again, you know? So like that's basically where we remove buccal fat from the cheek. So those are trends that kind of have, you know, they're around for a couple of years and then they go away. And then there's ones that are like, they would, I never did any of them, but they were the ones where it was the fox eyes, I guess, where they would like raise the corner of the brows and the eyes to try to create some type of, there was somebody famous that probably had that and everybody tried to copy it. Those are more very transient, like, oh, they've been very popular for about a year and then they kind of fizzle out. So we definitely see a bit of both.
Yeah, that, and you see that in a lot of celebrities too. It kind of mirrors it, like the buccal fat removal. Like I think in particular, because like nowadays you see lots of like social media celebrity kind of people. They just have super hollow cheeks, and I personally think it's a little weird, but you do you, I guess.
Yeah. Well, you know that there's something to be said about these influencers because they really do, in particular, influence, you know, especially younger patients. You know, I remember um, one of the Kardashians. You know, once she started kind of filling her lips, everybody wanted to do lip filler. And literally, as soon as she dissolved her filler, people were like, I'm going to dissolve my filler. So, yes, they do see something in someone that they follow. And then all of a sudden, the light bulb clicks and they go, okay, that's kind of what I want to do. You know, that's not ideally the kind of patient you want as a plastic surgeon. You know, so I always kind of ask patients, how long have you been thinking about that? You know, and if they say, oh yeah, I saw it on an Instagram post, you know, a few weeks ago, now I want to do that surgery, I kind of go, you know, you might want to think about this for a little while. You know, you just had this idea. Don't make rash decisions. Don't suddenly jump to doing something, you know, that's going to alter your body for the rest of your life. But patients definitely see things on television, social media that drives them to their plastic surgeon seeking. Can't tell you how often they go. I have patients who will like show me a particular supermodel's breast and be like, I want her breasts, you know? So we are uh, influenced by these influencers for sure.
Yeah. And do you tend to see that a lot on the social media side and also on like the traditional media side of reality TV and celebrities and things like that?
Probably more, I think, more on the social media side for sure. I mean, everything is on social media these days, you know. So I think probably social media, especially, you know, Instagram and TikTok, play a greater role in influencing um, patients than say, oh, I saw something on television.
Yeah. I'm probably a few, maybe like 10, 20 years ago, it was kind of the opposite where social media was kind of emerging. It was a little new, and you would see like, I don't know, Kardashian doing or had some operation, and they would come into your office and be like, I saw this on TV. I need it now.
Right.
Yeah.
Yes.
With the rise of the social media aspect of how you're getting a lot of influencers affecting people's wants in a cosmetic procedure, have you seen a lot of younger patients come in? I mean, I guess this is a little bit more focused on like the facial side of people wanting nose jobs and things. But have you seen a little bit of a younger patient base?
Um, yeah, especially in the non-surgical, minimally invasive procedures. It's not unusual to see women in their late teens, early 20s coming in for, you know, especially lip filler, you know, which is something that, you know, 15 years ago, to have a 19-year-old walk into the office and want their lips fuller was something that I couldn't have fathomed. But yeah, made it's made plastic surgery more accessible. It's it has definitely helped our practices, without a doubt. But certainly in the facial aesthetic stuff, and especially in younger patients, they are coming in and saying, you know, I want more defined jawline. Let's do filler here. I want a more defined chin. Let's put a little filler here. I wish my cheeks were always a little bit fuller. I want to, you know, do that. Or the most common thing is young girls who are in their late teens, you know, 19 to early 20s, who are coming in for lip filler, which to me is relatively young, you know, to start altering your body. But as long as it's done in a natural way, not overdone, then I think it's obviously still okay for a young patient to do things like that.
Yeah, there's this trend of preventative Botox where you're like, you have no wrinkles right now, so you get Botox that later you don't. Does that work? How does that make you feel?
Yeah, so that's actually a very interesting question. So I actually do think that starting Botox, and I'm not telling patients to start Botox at a young age, but I do think that as soon as you start to see some of the fine lines, if you do Botox, I really do believe that it can delay or prevent the formation of fine lines. Now, there's there's a difference between doing it at 20 years old when you don't have a line on your face and you're years and decades away from even getting crow's feet or, you know, frown lines, versus someone who's in their 30s, right, which is still relatively younger than the average, you know, what we used to think is the average Botox patient, who comes in and says, you know, I'm just starting to see this stuff and I don't want it to get worse, you know. And so we've even, although I think it's been adopted, we've coined the term baby Botox, you know, because we do baby dosages, like very, very small dosages. So I'm not actually opposed to that. I think when patients ask me when they should start doing Botox, I say, as soon as you start to see those little fine lines coming up, you don't need to do it every 3 months. You don't need to do a lot, but even that little bit can help. You know, I've been doing Botox since I started my plastic surgery fellowship. So, you know, we're talking back in like 2003. So I've been doing Botox now for, I guess, 21 years. And I can honestly say that I think that I have fewer lines and wrinkles on my face relative to some of my friends who are the same age who haven't been doing Botox. So there is some truth to it.
Yeah. And I think it is a little different if you're 20 and like as you said, you're 20, you don't have a lot of lines in your face, you're getting Botox versus you can see the wrinkles and then getting a little dose to prevent that down.
Right. Yeah. I mean, I think I would hope that if somebody came to a plastic surgeon in their 20s and was like, I want to do all this Botox in my face, they would say, you really don't need that, you know. And even at a young age, you really want to see something. You're just starting to develop it. Okay, let's do it. But if you really have nothing, what are you preventing? I mean, I don't think you're preventing much. So um, you just have to choose your patients wisely, counsel them wisely, and but it can be, you know, especially this is where kind of things get a little bit fuzzy when you're going into a medical spa type setting. That you know the practitioner there is incentivized to do more and more and more. You know, so that's where sometimes you have to just be careful who you're going to because they might just tell you what you want to hear. Oh, you want Botox? Great, let's do Botox. As opposed to, you know, you're probably not really ready for this. You're too young. You need to wait a little bit. There's no incentive for you doing this right now. You know?
As we're talking, I think when we imagine the typical plastic surgery patient, we're always imagining like a woman or a female. Um, how many men do you see in your practice? Because I know it's a lot less, but is it almost zero? Is it like one or two? Like,
I would say about, sorry, I would say about 10% of my patients are are men. There are some of my colleagues whose practices are definitely a higher male population. But you know, the things that are commonly done in men is liposuction. That's probably the most common procedure I perform on a man is lipo. I think the most common procedure, surgical procedure performed on men is probably hair transplantation if I'm not mistaken. So I don't do hair transplants, but my colleagues who do, like all their patients are, almost all of their patients are men. So it really depends on kind of what your niche is. You know, obviously as a doing a lot of breast surgery, not a lot of men coming in for that, generally speaking. So it really depends on the practice, but there has been a gradual rise in the number of male patients who are also coming in for plastic surgery. But still, I would say the the majority of patients are still women. The majority of the patients are in the, you know, in their 40s is the typical patient. And that's very true for my practice as well.
yeah, I would not expect that you see a lot of men who want liposuction. It just doesn't compute in my brain for some reason.
Oh, really? Yeah, no, it's actually very common. And also, again, my practice is not heavily facial aesthetic, but some of my colleagues who do just facelifts, I'd say about 50% of their patients are men. So men are coming in, they're doing more subtle things with their faces. You know, they're not wanting to go home looking like this. Um, but it really depends on your practice and kind of what types of surgeries you're performing. But there are quite a few men who are having plastic surgery. They just don't talk about it as much. That's the big difference.
Yeah. Why do you think that is that plastic surgery is so plastic surgery patients are so predominantly female?
I think it's just the the nature of just the difference between men and women. I think that women are definitely more geared towards aesthetics, you know, based on looking like when you look at fashion, makeup, hairstyle, you know, there's a lot of those things are geared towards women because women are into that. You know what I mean? Like obviously I only have one hairstyle, you know, your hair is relatively short, you know, but like you don't do radical things. You're not going like you get a haircut, but you're not necessarily, you know, getting highlights or changing the color of your hair. I think it's just the fundamental differences between kind of men and women. It's a lot harder to be a woman. Let's be honest. Like we're fortunate as guys, like you can, the expression like, as a man gets older, he's like fine wine, it's like gets better with age. Well, who says? Who says that's not true about women? It's just unfortunately our society stigmatizes women aging more than it does with men, So I think it's societal, honestly.
Yeah. And yeah, you're totally right. It's much harder to be a woman.
It's much harder to be a woman these days, for sure. I mean, it's a lot. People are a lot more judgmental about how women look, and women in particular are a lot more critical of themselves, a lot more critical of how they look. I don't know why that is, but it's very, very, very true that women, you can have a husband and a wife, and the husband's overweight, and he's looking in the mirror thinking, I look great. And the woman's in amazing shape and just has like a tiny little bit of excess fat. And she's like, oh my God, I look terrible. And I go, no, you don't look terrible. You look great, So women just tend to be more critical of themselves, I feel, as well.
Yeah. And yeah, I think also women are critical of each other a lot more than men are critical of each other. That's just from what I've seen, but
Yeah,
um
yeah, I mean, I joke with my friends if it's a guys' night. I'll be like, "How come you guys aren't coming in and having Botox?" So, more as a joke. You know what I mean? But I think with guys, there's still a little bit of a stigma with plastic surgery. So even if they're getting it, they're just not telling their buddies. Um, yeah, I think it's just a societal and just the nature of the differences between men and women.
do you see a lot more men in like a reconstructive practice because of some kind of like trauma? It's either like their hand or some extremity, and you need to reconstruct that.
Yes, for sure. So when I did a lot of hand surgery, when I first came out in private practice, I was doing a lot of hand surgery. And who's injuring their hands? Generally, people who are doing more manual labor, there's more trauma. So, yeah, for sure, I think there's probably a more 50-50 split between men and women in reconstructive surgery. But in the aesthetic world, I'd say it's predominantly female driven for sure. Um,
Yeah. Going back to like the reconstructive aspect, what's um the most common like reconstructive, I might have asked this already. Anyway, what's the most common reconstructive procedure that um like that you would see in a hospital, not necessarily as like a breast reconstruction or something like that?
Well, actually, that would be the most common type of reconstructive procedure that's probably performed is breast reconstruction.
Mhm.
Obviously, there's literally any part of the body that you can imagine. There's reconstruction. That case that I told you about, where the guy's tibia was exposed. They wanted to amputate him. That's lower extremity reconstruction, but that's far less common than breast reconstruction. So most of the plastic surgeons who still have kind of like some of my colleagues have about a 50-50 practice. They do reconstruction and they do cosmetic. Most of their reconstructive surgery is actually breast reconstruction. That's probably the most common reconstructive plastic surgery that's performed today.
Yeah. And how does that work? Are you like suctioning something from the abdomen, or like, I don't know.
Yeah.
Educate me,
So,
please.
I haven't done breast reconstruction for many, many, many years. But basically, breast reconstruction falls under, there's two different types of reconstruction. One type of reconstruction is using an implant. So what you do is after a patient has had, say, a part of their breast or their entire breast removed, you put an implant under the skin, you slowly expand that implant. It's called a tissue expander. And what that's actually doing is stretching the skin back out. And you're trying to reshape and reform that skin envelope that a breast has. And then you remove that expander, right? So imagine it's like a balloon, it goes in deflated, you slowly inflate the balloon. The shape of the expander is kind of shaped like the way you expect a breast to be shaped. So it slowly stretches the skin out. And now you take that expander out and then you'll put in a permanent implant into their body. And that implant takes up the space that you need for the breast. The other option is using the patient's own tissue. So there's a lot of different techniques for breast reconstruction using a patient's own tissue. The most common type of breast reconstruction uses the skin and fat from the lower abdomen, very similar to the skin and fat that we usually remove when we do a tummy tuck, and they use that paddle of skin below the belly button, kind of in the lower part of the abdomen. That tissue is basically transferred to the breast, and you can transfer it by essentially keeping it attached to the blood supply, where in which case we refer to that as a flap, or you can actually detach it from its blood supply, preserving the artery and the vein that's providing blood to that tissue, and then you bring the tissue here and you find a new artery and a vein, and using microsurgery, you actually sew those two, the artery back together again and the vein back together again. And now, say, a blood vessel here along the ribs is now providing blood supply to that tissue, and that skin and fat is used to create a new breast, basically.
That is so cool.
It is very cool. I agree. And talking about it makes me kind of go, I miss doing that. Some of that stuff.
Yeah, wow, that's amazing that we can do that.
Yeah, and that's just with breasts. I mean, that case that I told you about, that's the beauty of plastic surgery is that, especially if you really are. I love plastic surgery. I love cosmetic surgery. I'm very happy that my practice is cosmetic surgery driven. But there's so many amazing and unique surgeries that plastic surgeons do, where we it literally take inventory of, well, what's missing, what's available in the vicinity, and how can we use the adjacent tissue to reconstruct what we have. So that case that we've kind of talked about, I took a muscle from the back of the leg, the calf muscle, and I swung that muscle back around to the front of the leg to cover the hole and to cover the bone. Now, part of that muscle is used to help, basically, if you stand up on your toes, you're using your calf muscle. Fortunately, we have two of them. There's one on the inside and one on the outside. So you can actually take one and swing it around, and the patient can still, stand on their toes, not as well, but so that's kind of the beauty of plastic surgery. You really have to understand all aspects of the human anatomy and know how you can move tissue around.
Yeah. How do you balance like maintaining function with moving a muscle into a different direction versus like the actual aesthetic outcome?
I mean, so there's always something that's sacrificed, So in that case, the patient does lose some function, but overall, if they're let's say they're a superstar athlete, yes, it could affect their ability to work, in their chosen profession. They're a soccer player or a basketball player. But for most people, if you're a little bit weaker standing on your toes, but at least you got a leg to stand on, it seems like a pretty good trade-off. So there's always something that's sacrificed. You don't get something for nothing. So even in breast reconstruction, obviously you have to remove that skin and fat from the lower abdomen to put it up here. That results in a relatively long scar, very similar to a tummy tuck scar in the lower abdomen. So you are sacrificing something, but you're gaining something as well. And then obviously when we do even reconstructive surgery, we want the patient to look as normal as possible. But I think function takes more of a precedent than, say, aesthetics. So the guy that I saved his limb, he didn't come back and say, how come, I have this bulge on top of my bone? Well, it was that muscle that we used. He's just so grateful that he's standing on his leg and he doesn't have to, live with an amputation. But obviously, we don't want to create something that looks horrific either. So, but function takes more of is more important than the true aesthetics. Especially with like lower extremity reconstruction. But with the breast, obviously, it's a balance of both. You can't just make a breast that doesn't look like a breast. It still has to look beautiful.
Yeah. And oh my God, I still can't get over that. They reflected the calf muscle over. Like, that's crazy, crazy stuff. So if someone is looking to go into a plastic surgery residency, what is that going to look like for them?
Well, it's very challenging. Plastic surgery as a field is very competitive. Obviously, there's a lot of people want to become plastic surgeons, and so it's a very rewarding field. And it has, can have a very good lifestyle. So there's a lot of medical students who, want to go into plastics, and because of that, it becomes extremely competitive. I mean, it basically comes down to supply and demand. There's a huge demand, and there's just not that many programs. So it tends to be one of the hardest fields to kind of get into. I myself didn't go into an integrated program because those are even harder to get into than the traditional programs. But it's you have to have very good grades in medical school, lots of honors. You have to do very well on your United States medical licensing exam. You need to do research. You need to do rotations at other hospitals beyond just the hospital, or I should say other training programs, where you rotate and you can do like an externship. So you can rotate on plastic surgery at this hospital that you really want to go to. But it's competitive. It's very, very hard. But anybody who's passionate about it, I would encourage them to pursue it because it's a very rewarding field.
Yeah. How does a medical student know if they're more suited for an aesthetics practice versus a reconstructive practice?
That's actually a little hard to tell when you're in training, right? Because most training programs are not cosmetic heavy. You know, I still had a lot of cosmetic surgery experience during my time. I trained at Oregon Health Science University and had a great balance of reconstruction as well as cosmetic surgery. But really, when you're at, say, USC or UCLA, most of the stuff you're seeing is reconstruction. The majority of what you're seeing is reconstruction because most people aren't going to, say, UCLA or USC to find a cosmetic surgeon. I mean, there are some, right? So when you're in training, you definitely see more of the reconstructive side. And when you're a medical student, you really see more of the reconstructive and a little bit of the cosmetic. So it's hard to really know what you want to ultimately do. I envisioned when I finished my training, I thought I was going to do about 40% reconstruction, 40% cosmetic, and like 20% hand. I was like, yeah, that's perfect because I want to be able to do a little bit of everything. And for a number of different reasons, some of them financial, it just made more sense to gear my practice towards cosmetic surgery. So sometimes you don't know what your plastic surgery career is going to look like until you actually start practicing. I have some friends who are plastic surgeons, and they will admit, I am not good at cosmetic surgery. I'm not good at dealing with patients who are concerned about little tiny details and aesthetics. And their practice is more geared towards reconstruction. Not to say that they don't necessarily do beautiful work, they do, but it's just the patient who's coming in for reconstruction has a different mindset than the patient who's coming in for a strictly cosmetic procedure. So sometimes you just don't know what you're going to do until you start doing it, and you realize what you're good at, and then that kind of you're I don't want to say you get kind of pigeonholed into doing something, but I do a lot of breast and body work because I guess I do that really well, and that has brought more breast and body patients to me, as opposed to other types of, surgeries. I don't do a lot of fat transfer to the buttock. It's not my focus. Doesn't mean that I don't do a good job at it, but for whatever reason, that hasn't been the trajectory of my practice.
Yeah, and I think that's with a lot of specialties is you have to go be out in practice so you can kind of get a feel for how the real environment of it is instead of being like supervised by your attending and all these other factors.
Yeah, I mean, I would tell a medical student who's thinking about plastic surgery, I would say, if you're not passionate about plastic surgery as a whole, which is really, cosmetic surgery is just a very small part of what plastic surgeons do. If you're not passionate about plastic surgery as a whole, don't go into plastic surgery because, you might go into it thinking, I'm going to become a cosmetic surgeon, but you may not really be, cracked out to be, you're not meant to be a cosmetic surgeon. And if you don't like the bread and butter plastics, the reconstructive stuff, you may find yourself very unhappy. So if you don't love the reconstructive stuff that you're seeing at the hospital and, during your rotations as a medical student, don't put all your eggs in the cosmetic surgery basket because you don't know if that's really going to come to fruition.
Yeah, because at its core, even cosmetic plastic surgery is still reconstructive plastic surgery. It's just
Right, for sure. Absolutely. There is that aspect of kind of reconstruction. And there's a lot of that, especially with the body work that we do.
yeah. What was the most valuable thing that you learned in medical school or residency?
The most valuable thing that I learned. Wow, that's a good question. Um, I think the most valuable thing that I learned was listen to your patients. I know that might sound rather bizarre, but many times the patient is right. They'll come in and they'll tell you something, a problem they're having or something that's happening to them, maybe during the recovery, and you really need to listen to them, and not brush them off. Um, so I would say that's probably been the most important lesson that I learned in medical school was your patients, they want you to listen to them. They want to be heard. And when they feel heard, they will I think they will appreciate you as a physician a lot more rather than, I'll give you like an example. Patient walks in, wants a breast augmentation, right? Well, okay, so we're going to put an implant in you. That's the end of the consultation, theoretically. You want implants? I'll put implants in you. But really kind of understanding where's the patient coming from? What are their goals? What are they really hoping to achieve? Helping them, not helping them, but really listening to them and helping them to feel heard is so important as a plastic surgeon. So it goes to patient who's coming in for a consultation. They want to be heard. You really need to listen to what they're saying. To the patient who's coming in after the surgery and maybe has a very small complaint about something, but unbeknownst to you, that's actually the sign of something bad that might be going on. So don't brush things under the rug just because the patient, what do they tell? They don't know anything. They're not a doctor. A lot of times they know what's going on with their bodies and they'll say something. And if you investigate enough, you'll find that, they're right about it.
Yeah, and you hear all kinds of stories of they went to 48 different doctors for whatever, like if somebody went to 48 different doctors for some unspecific condition, and it turns out that it was some devastating thing that no one could catch because they were just like, oh, whatever, the patient is just making things up so that they can come and see me and bother
Right.
me.
There's definitely some of that. I'll give you an example. I just saw one of my patients who's now a couple of months out from a breast lift procedure that I did to her. And she admitted to me, she said, "You were the 10th doctor that I saw." And usually if a patient tells me I've seen 10 doctors, it's a little bit of a red flag because you're like, why are you shopping around for so many physicians? But what she said to me was, she said, of the 10 surgeons, you're the only one who sat down and listened to me and asked me what I want to achieve. What is the look that you want? All of them said, "Oh, you think your breasts are a little bit low? You need a breast lift. Here's what I'm going to do." She said, I was the only one who actually sat down and listened to her, asked her more questions about the things that she said her goals were, and really got down to like the specifics. And she said, "I really felt that you heard what I said, you understood what I wanted, and I wasn't just some cookie cutter procedure to you." So I think that kind of goes back to the, listen to your patients.
Yeah, I would totally expect that most plastic surgeons are trying to manage expectations and form outcomes based on what the patient wants, and not basically just slotting them into a box of you need a facelift or you need a breast lift. Let's just do it.
But it's a challenge because obviously the more patients you see, the more surgery you do, the more lucrative your practice is, you know. So a lot of doctors, even, they're busy, so they don't have a lot of time to spend with the patient. They'll walk in. I can't tell you how often patients at the end of the consultation will be like, "This is the best consultation I had. I saw 3 other surgeons. You're the only one who spent, an hour with me, talking to me and discussing this stuff with me." You know, some of my colleagues might see 4 patients during that hour, you know, but that's not never been my style. That's not how my practice is. And I think that's, I guess, maybe, part of the reason that I have been successful is because of my approach to patients. Even though I'm very, very busy, I still really try to put a lot of time and energy and focus on the patient when they're here, so that they feel heard and I really understand what they're trying to achieve.
Yeah, how do you balance spending a lot of time with the patient, but also like being busy and keeping the practice open?
It's hard. It's very, very hard. That's where I have other people in my practice, whether they're medical assistants or whether it's my nurse, who are with me, who basically still provide, especially in the aftercare, provide the patients with the care that they need, but I'm really there doing the medical part. So I'm doing the most important part to me. There's other things that involves the TLC and, the hand holding that, takes up a lot of time. And that's where kind of my nurse and my medical assistant are kind of there to still provide that level of care, but not necessarily with me. I'm there to make sure there's no bleeding, there's no infection, everything is healing well, you're doing well, you're not having any complications. Great. The nurse and the MA are going to teach you how to, how are you going to take that first shower? What are you going to do with your wounds? What are we going to do with your scar? So a lot of that teaching is done with them. So that allows me to spend more time on consultations and have the luxury of spending an hour with a patient.
Yeah, because in some practices they're just going really fast through patients, and especially in something like plastics where time with the patient can completely alter the outcome that they have, um, is just kind of crazy, you know?
I mean, my practice, thank God, and I'm busy, but it's definitely more of a concierge boutique type practice. I'm not seeing 50 patients in a day. Busy day for me is, I've seen 20 to 25 patients. Some of them are consults, some of them are follow-ups. But, I have been to some of my friends' offices and there's like a ton of patients sitting in there, and he's running an hour and a half late. Everybody's pissed off. It's like that's that's not my practice at all.
That's really good.
Yeah, I mean, some of them may make more money, but at the end of the day, that's not ultimately what the driving factor is. Like, I love my patients. Like, when I told you about, like, at some point I don't need to see them anymore, a lot of times it's kind of sad, because we've developed a relationship together, and I kind of go, you don't have to see me anymore. And I can't tell you how often patients will be like, can I just still come in and say hi? And I'm like, of course you can come in and say, we would love to see you. And that still happens, especially around the holidays. Patients who I haven't seen for years will suddenly come in and be like, I missed you guys. I haven't seen you in a year. I wanted to just bring something in to you guys. So it's very nice. I'm very fortunate.
Yeah, and a happy patient is priceless.
Yes, yes. And an unhappy patient is horrible. It's horrible, horrible. And thank God that's extremely rare in my practice. I'm very fortunate
Yeah.
for that.
My last question is, you kind of answered this a little bit, but what is your advice to the aspiring plastic surgeon today?
Um, my advice would be to, if you're done with your training and you're trying to figure out where to go, go to the city or the place that you really want to live. LA is a very, very competitive market. If I had started my practice, let's say I had stayed in Oregon, I probably would have had a faster trajectory towards a, successful practice. But I would be living away from my family. I'd be living away from my friends. I wouldn't be in this beautiful Southern California. But that also came kind of at a cost because it takes longer because it's a more competitive market here. So I would say find the place that you want to live ultimately, establish your practice there. And if it's in a very competitive field, just know that it'll take a little bit longer for you to kind of have a mature and established practice. But in the long run, I think you'll be happier where you are.
Yeah, very well said. Thank you so much, Dr. Zarrabi.
Oh, you're very welcome. This was fun. I enjoyed chatting with you, and if there's any other questions, I'm happy to always get on another call and we can continue the conversation. But I enjoyed this. Thanks for reaching out to me and allowing me to speak to you and your audience.
Yeah, of course, of course. Thank you so much for your time. Again, I'll hit you up if I have any questions.
All right, everyone. Great meeting you. Great seeing you, I should say. I know we've met before. Sorry. Great chatting with you, and thanks for the opportunity.
Yeah, of course. Thank you so much.
Okay. All right. Take care. Bye-bye.
Bye-bye. Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.